Testing 1, 2, microphone test.
Good afternoon, people. Good afternoon. Hi, welcome. Dear colleagues and friends, it's great to see so much engagement. It's been 6 years since we were together physically in a room, so it's really a pleasure having you all. It's with immense pride that I, as the chair of EMEA-NI, the Nursing Informatics Group, warmly welcome you all to the 16th International Congress in Nursing Informatics. We are united here today with representatives, should be a picture here as well. No, this is wrong. So where are mine? Oh my God. Doesn't matter. We could take it later. I'll just talk. The worst thing was I lost all my slides and I've been spending the last hour to rebuild them. Okay. But I continue. We are united here today with representatives from across the globe, an embodiment of our diverse and vibrant community. Just as the Olympic Games opened with grandeur in Paris 2 days ago, tonight we are gathered amidst the historical splendor of University of Manchester to inaugurate our own prestigious event. Digitalization and informatics development stand on the shoulders of giants, the historical innovators and researchers whose contribution were pivotal. This year, as EMEA-NI celebrate its 40 years anniversary. That's not bad. We honor the pioneers whose groundbreaking research and developments have enhanced quality of nursing and healthcare. Our honorary member will soon share their momentous journey across these 4 decades. To you, our dear honorary members, I extend a heartfelt gratitude for your dedication to advancing nursing informatics. One might ask, is nursing informatics crucial? Yes, it is. Nursing informatics is the vital link that integrates nursing science with multiple informations and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. Nursing remains at the core, with information technology serving as an invaluable ally, ushering in evidence-based knowledge that is both accessible and implementable, thus optimizing patient outcomes. We all strive for the highest quality of care, yet human capacity has its bounds. If we are aiming at 100% quality, and we should, the overview over available knowledge, we know that based on brain research and psychology, we only know about 1/3 of what we should know. And out of that 1/3, we forget 1/3. And out of that 1/3, we implement 1/3. So that means approximately 12.5% of 100% possible knowledge is implemented in care. We can't do it without digitalization. We can't manage. Digital transformation in nursing informatics are not just useful, but they are essential tools in transcending these limitations. And they are critical for the patient's safety and quality of care. Supporting and driving upfront research and development of nursing informatics, eHealth worldwide, that is what EMEA-NI is doing. The role of EMEA-NI is to champion progress in nursing informatics through global collaboration. Your individual studies are vital drivers of this development, yet the power of collective efforts can amplify outcomes, foster innovation, and yield novel insight, streamlining the journey ahead. EMEA-NI is the nexus for such collaboration. While individual society membership in EMEA-NI is limited, it's only one person per country or society, our advisory panels are open to all of you. Here lies the opportunity to share best practices, experiences, and ideas to tackle challenges, to discover research partners, and so on. The recommendation of these panels directly influences the EMEA-NI board, allowing for a genuine impact of the future of nursing informatics. Our vendors and exhibitors, too, they are integral in realizing and developing digital healthcare solutions, and we appreciate their partnerships and support. Together, we are contributing to a grand vision, a stronger, more cohesive global nursing informatics community. And with that mission in heart, I urge you to be inquisitive, to engage with your peers, to stimulate, to be stimulated by fresh ideas. I entreat you to connect with our exhibitors and sponsors, expand your networks, and to remain an active participant in our community today at this Congress and tomorrow through our advisory panels. Together we forge ahead towards an even brighter future for nursing informatics all over the globe. Thank you so much. And with this, I will hand over the words to my hard-working colleagues who has taken a great and wonderful leadership in planning this Congress, Dawn Dowding and Leanne Curry, the chairs of the Scientific Committee.
Okay, before I start, I just wanted to acknowledge some of our sponsors and exhibitors who you will find downstairs in the reception area where you registered. Can I encourage you to all go and find out about what they've got to say about nursing informatics? We really appreciate the support they've given us to set up the conference. So I'm just going to flick through all of them, and hopefully we've included them all, particularly Elsevier. So, on behalf of Leanne, my co-chair, and I, and the rest of the Scientific Programme Committee, we would like to welcome you to NI 2024. This is the 16th International Congress in Nursing Informatics, and as Ann-Kristin has already said, it's also the 40th anniversary of the establishment of EMEA-NI, our professional group within the International Medical Informatics Association. I am particularly pleased to welcome you all back to the United Kingdom and my adopted hometown of Manchester. And for those of you who've never visited Manchester before, it's always sunny, always. It never rains and it's never cold. So, so we particularly welcome the weather gods. For those of you who aren't aware, the first International Congress for EMEA-NI was also held in the UK back in 1983. And we are absolutely delighted to welcome some of those pioneers in our field here to the conference this year. The theme for the conference is Innovation in Applied Nursing Informatics. From the start of our planning, which was over 2 years ago, and it's been a very long 2 years sometimes, we felt it was important to recognise that any innovations in informatics are also applied into healthcare settings, and to improve the care we give to our patients and their families. Given this focus, you will have noticed that this year we have a presentation called Case Studies.
You okay?
You okay?
The chair broke, it looks like.
Okay. I'll carry on. So we have a new presentation for the conference with case studies where we specifically wanted to highlight how we can take evidence-based digital interventions into practice settings. Another ambition of our conference was to enable attendees to learn from the wisdom of our pioneers in nursing informatics, as well as look forward to the future of our science and our discipline. Since the global pandemic, we have seen a rapid transformation in how we deliver healthcare internationally. The use of digital technologies is now integrated into many healthcare systems in a way that we have not seen before. This makes it increasingly important that nurses, and specifically nurses with expertise in the science and application of those technologies, are skilled and able to share their expertise internationally. We hope that during this conference you will have the opportunity to learn from others, make new collaborations, and go on to forge new friendships. In this room today, there are many individuals that I have met at previous nursing informatics conferences who I am now privileged to call my friends, and some of you know who they are. So finally, any conference like this is not the work of one or two individuals, but is the product of a vast number of people. So Leanne and I would like to particularly thank all of the members of the Scientific Programme Committee, Editorial Committee and Local Organising Committee, many of whom are in the audience and their names are up on screen. I'm going to ask that those people who are in the room today who are on that screen, could they now please stand up? Come on. And we can give them a big applause. And on behalf of both of us, we really want to give them a big thank you for all of their help, advice and guidance over the last 2 years of planning. It's truly without them we could not be here today. And finally, behind the scenes, downstairs on the desk and running around are the group from Conference Partners International. I can see Laura and Emma at the back of the room. They have also been brilliant in their support and help along the journey, so could we please also thank them as well. And I'm now going to hand over to Leanne.
All right, thank you, Dawn. Welcome, everybody, and thank you for your words earlier, and Kristen. And I am so pleased to show that we have over 30 countries represented at the conference this week, and we are just thrilled. Our program committee was also full of folks from across the world, and we're just so thrilled to see the community, international community, coming together as we have done over many, many decades now across our work as nursing informatics professionals. We had a total of 398 submissions with 275 accepted presentations. There will be 22 sessions with papers and case studies, including 88 papers and 24 case studies, 18 panel discussions, 16 workshops, 4 debates, that's also something we added new, and 4 technology demonstration sessions with 16 technology demonstrations. We have 6 tutorials that happened today, and we have 2 poster sessions with about 55 posters each day for a total of 111 posters to be presented over the next 3 days. You also will be receiving an email soon, and you can find in the welcome message from Dawn and myself in the app a link to the submissions, the proceedings that were published on Thursday as an open access 655-page document that is all of the posters, case studies, and paper presentations that were submitted and accepted for presentation at this conference. So we've got real-time knowledge translation happening, and we're thrilled that we made it under the line. The editorial committee worked so hard to make sure that we had this ready for sharing before the conference started. So you'll see your papers in there, and we're so excited about that. And now, I'd like to present Professor Alan Pacey, who is the Deputy Vice President and Deputy Dean in the Faculty of Biomedicine and Health at the University of Manchester. Welcome, Dr. Pacey.
Good evening, everyone, and welcome to the University of Manchester. As Dawn said, it isn't always as sunny, so make good use of the weather whilst it lasts. I'm Professor Alan Pacey. I'm the Deputy Vice President, Deputy Dean, although perhaps the interim or the acting, depending on how you look at it, whatever. But I'm currently in charge of the Faculty of Biology, Medicine and Health, and it's a real honour to welcome you here today and to help you open this event to celebrate your 40th anniversary. The University of Manchester is also celebrating its own anniversary this year. In fact, it's our bicentenary. The university was established in 1824 and was England's first civic university, and its founding was closely linked to Manchester's development as the world's first industrial city. Today, we're home to 41,000 students, and each year we welcome more international students than any other UK university. Given the number of international members here today and what we saw on the screen on the map, I can see that international collaboration and partnerships are as important to you as they are to us. Now, the university continues to achieve year-on-year elevation in global academic and esteem rankings. I'll give you some examples. We're ranked number 1 in the UK and Europe and number 2 in the world for social and environmental impact. Our commitment to achieving the United Nations Sustainable Development Goals is unmatched. We're the only university in the world to rank in the top 10 in every year of the Times Higher Education Impact Rankings. We're also ranked number 1 in the UK and Europe and 3rd in the world in the QS World University Sustainability Rankings, and that's for our environmental, social and governance impact. We're also consistently ranked in the top 5 universities globally for our nursing programs. The faculty, thank you. It's down to people like Dawn. The Faculty of Biology, Medicine and Health is one of 3 faculties in the university. The faculty has approximately 12,000 students, 3,200 members of staff, and an annual budget of about 300 million. We have 30 undergraduate programs and about 90 postgraduate programs. And the faculty itself is equivalent in size to many UK universities. It combines discovery biology, clinical application and patient care within a single faculty, particularly in a region of the UK with high levels of health inequality. And that provides us with a real opportunity to have a very significant impact on people's lives. And our efforts and partners stretch beyond the campus walls. We have ongoing projects in 1 in 5 countries worldwide, in low, middle and high income countries. And those projects look to improve healthcare globally, particularly projects that aim to increase the number and capability of researchers and healthcare professionals globally. These are just some of the examples of the difference that we can make with an approach that harnesses groundbreaking collaborations with local, national and international partners. Now, Benjamin Disraeli, an individual who twice served as a UK Prime Minister about 100 years ago, famously said that what Manchester does today, the rest of the world does tomorrow. And perhaps noteworthy for this conference is that we were the first university in England to offer a degree in nursing. And we were the first It gets better. We were the first to appoint a professor of nursing in 1974. That was Professor Jean McFarland, and she subsequently became a member of the House of Lords, the upper house of our Parliament. And there's now a building on campus named after her, and I think it's just behind us here, if my geography is correct. It's not a very good-looking building particularly, but you might want to go and have a look. Also of note is that Manchester is the place where Alan Turing, the mathematician who was famous for his groundbreaking work in code breaking during World War II, this is where he developed the small-scale experimental machine known as the Baby, which was the start of modern computing. If you're interested, that was in 1948. If you're interested in that part of our history, the building which housed his office is about 100 metres in that direction, opposite the other side of Oxford Road. And there's a nice plaque outside where you can read a little bit about the history if you're interested. If you get lost, it's just next to the building where Ernst Rutherford split the atom in 1917. Another Manchester first. Also born in Manchester was Christabel Pankhurst. She was a suffragette. And that was in Nelson Street, just half a mile over there. And the building, that was the building where she was born, where the first meeting of the movement that became known as the Suffragettes took place in 1903. It's worth a visit if you have time. Now, I point that out to this audience because the University of Manchester is now home to the Christabel Pankhurst Institute, which promotes needs-led health technology research and innovation. It provides end-to-end support for translation into practice and acts as an external flagship for the university's rapidly expanding health technology portfolio. It builds on the university's research strengths in digital technology and advanced materials and develops innovative solutions to pressing healthcare challenges, fostering new collaborations and improving lives and catalysing growth in health innovation business sector. Similarly, we're a member of the International Centre for Translational Digital Health, a joint collaboration between the University of Toronto, the University of Manchester and the University of Melbourne. And the focus of this centre is the creation and commercialisation of new technologies, the translation of theory into more effective public policy, and the strengthening of health services delivery. Our goal is to transform lives, and we recognise, as you do, that digital technologies are integral to our success. Given our overlapping interests in linking nursing and the use of digital technologies and innovation, interdisciplinary working and research, our goal of reducing health inequalities, we're really pleased that you're in Manchester, and we're pleased to be hosting this conference this week. I hope that this conference helps each of you to foster new connections, strengthen existing relationships, and envision new collaborations so that together you and we can continue to transform lives here and around the world. Thank you.
Thank you, Alan. So it is my great pleasure to now introduce Professor Nicola Ranger, who is the General Secretary and Chief Executive of the Royal College of Nursing of the United Kingdom, who's going to welcome you on behalf of the nursing profession, hopefully.
Good afternoon, everybody. For those who don't know me, I'm Nicola Ranger, and I'm the newly appointed General Secretary and Chief Executive of the Royal College of Nursing. And it's my absolute pleasure to be here today and part of this wonderful opening ceremony for the 16th International Congress of Nursing Informatics. I'd really like to welcome you. It was amazing to see where you've all come from. I've probably only just come up from London, but I know many of you have travelled far and wide to attend this special event. So we really welcome you to the UK. I just want to take a couple of minutes to talk to you about the Royal College of Nursing. It's the largest professional body and trade union for nursing in the world. And as was just mentioned, I thought I would have to show our history to the suffragette movement. We have a beautiful building in central London that was a gift of Lady Cowdray, who was a suffragist. She supported the suffragette movement. And it was the first professional women's club in London. And actually, I'm afraid we didn't let men in till 1970s. So amazing, amazing history. We support to exist our members to be the best nursing professionals they can be, to work in healthy workplaces and focus on what's important, delivering high quality, evidence-based care for our patients. Our expertise covers all areas of nursing, from professional practice to policy, to clinical practice to industrial relations. This puts us in a unique position to shape the profession, to influence policymakers, and to support the hundreds of thousands of nurses who deliver care. And while I'm keen to recognise the great history of the RCN, it is my focus to be fixed on the future of our profession. I've been a nurse for nearly 40 years, and I know that globally, nurses are currently under more pressure than they've ever been. I don't think we should, any of us, underestimate the impact of the pandemic on nursing globally. I was privileged to be the chief nurse at King's College Hospital in London during the pandemic. At our peak, we looked after 800 patients with COVID, and 140 of them were ventilated. And I can tell you that has had a profound impact on our profession. And actually, many nurses across the globe are struggling with that impact. This is why digital innovation must play its part to free up valuable nursing time so that people can really spend time with their patients. This relationship with technology, for many nurses in frontline areas, is sadly not the relationship we want it to be. Too often, we have improvements that gain in somewhere, but those improvements lose in another. We absolutely have to get this right. In the UK, too often we have digitalised computer records and electronic prescribing, which is all fantastic, but not the infrastructure to support that, not enough devices, too many passwords. So while we focus on safety and being able to get fantastic information, let's really think about that frontline nurse. Let's make digital innovation something that actually liberates nursing time. We need to think about the things that nurses do that are time-consuming, that we just need to focus on them so they can focus on their patients. I've seen the nursing profession change beyond recognition over the last 20 years. Registered nurses are degree educated, highly skilled and safety critical. Part of that transformation is through the increased use of technology, the use of digital systems and the development of nursing informatics. But at this moment in time in the UK, it's a challenging place to be a nurse. Nursing staff are sadly undervalued, and that lack of recognition is reflected in their pay. We're fighting for safe staffing and fighting to eradicate corridor care of patients in inappropriate settings. If ever the profession needed hope and help, it is now. This is where we need you to lead and bring that sense of hope back to the profession. My clinical background is intensive care, and I spent time as a nurse leader in America. There I saw some really impressive digital innovations. But sadly, in the UK, some of those innovations from over 20-something years ago are still not here in the UK. There are far too many organisations still reliant on archaic drug keys, where our most precious resource is acute hospital beds and community placements, and we have no digital transformation that connects up our most precious resource of hospital beds and community spaces. We have so much to do. But that's why I'm so pleased to be here today, surrounded by experts in nursing informatics. I'm a great believer in international conferences that bring together colleagues from all over the globe, from different cultures, different healthcare systems, and different viewpoints. There is so much to learn from each other. I look forward to learning about and celebrating the amazing work from experts here today. Please use this time to really, really listen to each other. Have those light bulb moments when you listen to some of the amazing speakers on the agenda. That's where we get ideas from, that we can apply to our specialisms and our clinical areas. After all, innovation is creating something new or improving something that already exists. Digital nursing is absolutely vital area of practice, research and education in the UK. The importance of it is ever growing, and rightly so. We need new technologies to genuinely change the way we work. But I know that change can be difficult, When you combine with new technology with a workforce that have very, very varying digital ability, I count myself in that group, because sometimes new technology can feel daunting, and many of us that are older wish we had a pen and paper sometimes, because it can feel quicker. So please reach out to them and take them on this journey with you. The context of this also requires leadership in digital roles. We absolutely have to be able to not just focus on the digital systems, but the ability to interpret relevant informatics and data so that we can really genuinely use that to inform individualized patient care. We need those nursing leaders of the future. The new Royal College of Nursing Institute of Nursing Practice is going to make sure that innovation and digital systems are at the centre of that learning. We have a very, very strong forum for digital innovation at the Royal College, and the co-chairs of the forum are Dawn, who is here, and Tim James, who contribute so much to our digital work at the Royal College of Nursing. And we're so pleased and delighted for all the work that they do. So huge, huge thanks on everything you do in that digital space. So we've got a lot to do, but I absolutely know that we need to be optimistic for the future, because digital space, digital technology is, I believe, the only way that we can start to transform and improve care for patients. Sadly, across the globe, we're in a world where every single dollar and pound and cent matters. Nurses are expected increasingly to do more and more with less and less. We also have nearly 40,000 vacancies for nurses just in the UK, and globally that goes into the millions. The only way to solve this is innovation and technology. But I do just want to end this welcome just to say that in all of the chaos, in all of the challenge post the pandemic, it still takes a remarkable person to be a nurse. We are highly skilled, compassionate, caring. We are professionals, we are experts, we are leaders. Nursing is both an art, and particularly for today, it is a science. And the future of the profession, we need to remember that, both an art and a science, both a heart and a brain. The work we're going to discuss at this conference is absolutely vital for the future of nursing. By educating ourselves, we can be more efficient, we can use technological developments and improve the way we care. So we free up ourselves not to save money, but to concentrate on what really matters, our patients. Our profession across the globe desperately needs hope. And I truly believe that nurse-led digital innovations is a key part of that. Because despite all the challenges, nursing is an amazing profession. And our patients need us to have that focus. So thank you so much for coming. I really, really look forward to you sharing and making the massive difference our profession and our patients need. So welcome and thank you.
Thank you so much, Nicola. We really appreciate your words and centering nursing's voice at our kickoff today. Now I'd like to introduce a video congratulations coming from Brigitte Saroussi, who's the president of IMIA, and she has some words for us. I guess I'm supposed to drive, sorry. There we go.
Dear nursing colleagues, honored guests and fellow visionaries, I am really proud and excited to open the 2024 Nursing Informatics Conference, especially this year, since EMEA NI is celebrating its 40th anniversary. As the president of the International Medical Informatics Association, I am really pleased to acknowledge the amazing progress nursing informatics has made and look forward to the exciting future ahead. Allow me first to thank all of the pioneer informatics nurses that blazed the path in creating this growing nursing discipline. Without all of their hard work and dedication, nursing informatics would not be where it is today. The last decade has seen EHR implementations, interoperability, consumer portals, population health management systems, and other computational tools, enriching the data ecosystem available to nurse informaticists. Not to forget the development of decision support systems, enhancing the transformation of data into information and knowledge, and thus enlightening the clinical decision making. Not all nurses are informatics specialists, but all of them need to understand nursing informatics concepts because health information systems are being integrated into every nursing role at the point of care and beyond. Nurses do not want to be passive consumers of technology, and here is the importance of your mission as nurse informaticians, bringing the clinical, technical, and leadership skills together to enhance the quality, continuity, value, and experience of healthcare. Allow me to recognize the efforts of the new generation of nursing informaticists that are experiencing a fast pace of change. As we stand amidst an era of unprecedented technological advancement, nurse mission becomes even more vital. The advent of big data analytics, artificial intelligence, and machine learning present with tools of extraordinary power, truly transforming the nursing profession. Yet, with great power comes great responsibility. It is incumbent upon you to ensure that these technologies are implemented ethically with a steadfast commitment to patient privacy and equity in healthcare access. You must be advocates for policies that support innovation while safeguarding the rights and dignity of patients. Indeed, at the heart of every algorithm, every data point, every technological breakthrough are people, patients whose lives and well-being are entrusted to your care. You must strive to ensure that your technological pursuits always enhance rather than replace the human touch that is the essence of nursing. You must strive for technology that does not overshadow the nursing intuition, but instead amplify the whispers of your experience, where electronic charts lessen your burden and smart monitors echo your senses, giving voice to the silent changes in patient conditions. You must strive also for technology, lifting nurses to new heights of efficiency, accuracy, and patient-centered care. For every line of code, every digital interface, and every AI-driven decision, wisdom whispers caution, because behind each piece of data and every case number in the electronic medical record lies a unique human story. I urge you all to continue pushing boundaries, questioning limitations, and seeking new horizons. Engage in interdisciplinary collaboration, participate in cutting-edge research, and contribute to developing standards that will shape the future of health informatics. May this conference serve as a catalyst for continued innovation and collaboration, for gaining knowledge and renewing the passion to make a difference in the lives of those you serve. I wholeheartedly wish you come together to embrace the synergy of engagement, the wealth of knowledge, the depth of insights, and the power of networking, all converging to shape a bright future in nursing informatics. I wish you all a very fruitful and successful conference.
Thank you, everybody. And now I have the privilege and honor of introducing Diane Skiba, a professor emeritus from University of Colorado and one of the most important pioneers of nursing informatics. And she'll give us... Diane is going to present for us a history of what's been happening for the last 40 years. And I'll pass that to you. You can see your slides on that monitor there.
You probably saw some of the slides while you were coming in that we're going and playing on. I am becoming the historian. So I am here to represent the honorary members of the society, and we've been putting together this presentation to look at our past 40 years. And as you know, we have started this organization right here in the UK. Maureen Scholes and Barry Barber got together. They met at different MedInfo meetings, and the next thing you know, they said, we need something in nursing. And they developed the Computers in Nursing, it was called at that time, and had the very first conference here back in 1982. And they brought along with them many countries that had at least one person, and sometimes it was literally one person who was there. And so it's really been this dramatic growing of conferences, bringing together people, bringing together countries to come in and be representatives, etc. And we had several conferences in a row, and you'll see where many of these are. It started here, the second Congress, then happened a couple of years after, then the third. And the third one was in Ireland. And after Ireland, we had Marion Ball.
There we go.
There we go. Marion Ball was the president of IMEA. And Marion said, you're more than a working group. We're going to make you your own organization underneath the auspices of IMEA. But we were no longer just Working Group 8. So that happened after Ireland, and since we've been really IMEA and I, and we were special interest group for a long time, but you can really see we've traveled the world with all of our conferences. Many of the conferences, particularly as we digitized as a conference, are all open access so that you can actually get all of the proceedings of conferences from years back. I also want to highlight the fact that many of our honorary members are here. And if you're new to the organization, and this is the first time, if you'd like, you can come and sit and chat with any of us during these times. We can help to connect you. Our networks are very broad, and we know a lot of people because we're old ladies and we've been around for a while. So we can point you in the right direction and stuff. So please take advantage of that. And lastly, to preserve our history, we started a project in which we interviewed all the honorary members. And all of their videos are on that website. And we'll have it posted out in the newsletter and everything, but the news site, it just came up. And we asked them a series of questions, like how they got involved, who affected them, who were their mentors, what challenges did they face, as well as what advice do they have for the next generations that are coming beyond us. Because we want to make sure this thing celebrates its 80th anniversary, not just its 40th. So thank you very much, and I appreciate you coming, and welcome from all of our honorary members that are here.
Thank you so much. And I wonder if the honorary members who are with us in the room can raise their hands right now, and we can see. Yes. Thank you for shepherding us to where we are today. We know that all of your efforts have often felt like Sisyphus, pushing that rock up the hill every day, only to have it roll back down over top of you. But we would not be here without your hard work and perseverance across all these decades. We're ever so grateful for everything that you've done and given to us. We're so excited to have the honorary members Wisdom Council on the dates that were, the times that were shown. I'm just going to go back to this on a Monday morning and afternoon session, and then a Tuesday morning session. We're very, very grateful that you've been able to organize these sessions for us to be able to be around your wise words and all of your experiences. So thank you to the honorary members. Now I'm very pleased to introduce Pamela Cipriano, who's the president of the International Council of Nurses, and who is here to give us our keynote presentation. The slides are down here, and there's water.
Okay. Hi, everybody. I'm so excited to be here with all of you today. I feel like I'm an adopted member of the nursing informatics community. Many, many friends, many members of the Wisdom Council. I love that word. But I'm so excited to be able to talk with you about the global perspective of how important informatics is and the digital transformation of nursing to really help us achieve our goals in terms of health transformation around the world. And I'm also pleased to be able to help you launch your conference, Innovation in Applied Nursing Informatics, as the theme that you've adopted. The other thing that is just humbling is the superstars that are in this audience and pioneers who have written the books, done the research, established the conferences, and have led the way for more than 40 years. I am honored to be among you and look forward to, again, hearing your wisdom and know that you will continue to share your knowledge, because this is such an important time as we think about nursing's contributions in the world. Let me take just a minute to tell you a little bit about the International Council of Nursing, and that is that we are a membership organization, and our members are over 130 national level organizations, membership organizations. We are 125 years old, and we were one of the first non-governmental organizations to be acknowledged by the World Health Organization, and we work very closely with them now. I want to just give you a snapshot through the lens of universal health coverage about one of the big priorities that we're working on through all of our members and through our work with the World Health Organization, the United Nations, and many other organizations. And then I'm also going to share with you the position statement that we established last year, the digital transformation of nursing practice. And that's really the basis for bringing all of this wisdom together as we think about how nurses are interacting with informatics and data science. So this slide, if you've never seen this little logo on the left, this is Universal Health Coverage 2030's logo. The United Nations had adopted the Universal Health Coverage goals in 2019. Now, that had been in the works for many years before that. It is part of the 17 Sustainable Development Goals that you heard mentioned a little bit earlier by Professor Pacey. And this is really to help establish a sustainable world. And it's everything from our environment to economic security to health. And sustainable goal number 3 is good health and well-being. Universal health coverage is a part of those goals. What we know is that half of the world's population does not have access to the care that they need. We also know that there are over 100 million unnecessary deaths that happen every year. And we also know that people are pushed in poverty. Those are the principles that universal health coverage wants to address. We want everyone to get the care that they require, quality care, when they need it, across the continuum from birth to end of life, as well as making sure that, again, that care is of high quality and it does not push people into poverty. So that's the goals that we're working on, making sure that that becomes a reality. The target is 2030, and we are very behind. Now, I don't need to tell you that the World Health Organization has a definition of digital health, and it defines the field of knowledge and practice associated with the development and use of digital technologies, because we've all been using digital technologies for many years. Now, how many of you have been a nurse for less than 30 years? Less than 30 years. Okay. So many of you are what we call digital natives. Many of you expect that your practice environment should be digitally enabled. But there are a lot of us that have a little bit more gray hair then that didn't grow up in that world and had to acquire that interest and skills. Plus, we have many countries that have not had the resources to be able to move to the level of having digital health in a way that most nurses want. And I think you heard Nicola make a mention of 20 years ago. We're very, very privileged in the United States to have extensive technology in most, but not all, of our care settings. So why am I the one talking with you about this, other than the universal health coverage certainly is a global goal? But I feel very fortunate having been able to go from the first real innovation, a tri-colored pen, right? Red, yellow, red, blue, and green. How many of you remember using those? Too many hands, right? Too many hands. But when I graduated from nursing school in 1976, which makes me 48 years of nursing, we had these tri-colored pens. We had everything in paper. We had, in the US, probably similar tools called a Cardex, which is what you lived and breathed by. It had all of your medications for your patient. It had your plan of care. It had your treatments. It had your family information, all of that. And you meticulously took care of it, and you couldn't erase anything if it was not correct or it changed. You had to cross it out. You had to initial it. You had to make sure that on your flow sheets and everything that you used those 3 colors, and you did all the little carets for your blood pressures and everything else, and connected the dots. You were the computer, right? You were the computer. We also lived under the edict that if something was not written down, was not documented, it didn't happen. Right, right. So fortunately, that didn't last too long in my experience. And so I was very fortunate that early on, when I finished my diploma nursing program, I quickly finished my baccalaureate and then received my master's degree and became an adult intensive care unit clinical nurse specialist. And I had 2 great experiences that I think really shaped my interest in understanding how we could really use technology. On the right, you see Dr. Barney Clark, who was the first artificial heart patient in the world. And I happened to be the clinical nurse specialist. We had just, literally, like within weeks, implemented an entirely new physiologic monitoring system in all of our intensive care units before his surgery was done. I was the expert. I was the one that knew every piece of technology. And I was basically on call 24/7 for about 3 months as we cared for Barney, as he allowed us to call him. And so it really became very obvious that, again, nurses are absolutely critical as we think about helping the team in addition to enabling nursing care. On the left-hand side there, that's not a photo of an actual place, but I was fortunate to work at Intermountain Healthcare, which together with the University of Utah developed the HELP system, which was health evaluation through logical processing. It was one of the first electronic records that was, like many others, was developed for billing and was developed for some documentation, but it also helped us begin the order entry process. It had helped us with medication documentation, and we had nurses who were doing research with those data, but a very intensive process. Moving on from there, we know, again, that many of you were involved in these early advances on the front lines of technology innovation. And these were the development of hospital information systems. We saw resuscitation ANIs that were used around the world, developed in Norway. We also began to use high-tech simulation, not as much in nursing as we did in medicine. And then we also recognized that we needed everything automated. We went from crank beds to electronic beds, which now today are highly specialized. We had continuous monitoring. I was fortunate to work with groups that were testing the technological interfaces, things like ASCII links and stuff that I don't really know how it works, but we knew that we had to have the HL7 interface and do all of those things in order to get the data into our computer. But we also learned that the advantages of technology were primarily physician-directed. Nurses were not in the front seat of that bus in terms of requesting technology to be developed to enable nursing care. We also know that, however, with the advent of electronic health records, that nurses, again, became very much part of the solution to any problem that our physician and faculty were having. So we began to have sort of a love-hate relationship with some of the technology, and we also knew that there were safety risks. And we knew that there were issues that we all would have to deal with as we continued to address the advantages of automation and the advantages of these new technologies that we knew were going to help all of us as end users of all these digital health solutions. But we also knew that we needed a seat at the table because we quickly realized, and I believe, again, this was mentioned earlier, nurses should not be passive users of technology. And that's what happened early on for probably at least 2 decades. We would get technology that nurses hadn't developed, didn't work correctly, was not intuitive, created a huge bottleneck, required more time, and we were not very powerful to be able to deal with it. One of the clinical examples that I will never forget was I had been a nurse for about 2 years. I was working in an open heart trauma ICU, and I worked nights because I loved working nights. You didn't have to deal with all the crazy people. And I had a patient come back that was on an intra-aortic balloon pump, but it was a new brand of intra-aortic balloon pump with a very different mechanism of operation. And it was like, whoa, where's the big machine? Where's the big Contron console that I knew how to listen for the sound, and I knew how to watch the waveforms. Those of you that are old in intensive care remember that. All of a sudden, we had this datascope machine that had like this external balloon that was supposed to mimic what was happening in the patient's aorta. Well, I was a very assertive young nurse, and I basically said to the physicians that came back from the operating room, you're sitting in that chair by this patient's bedside all night long because I had never seen this technology. This patient could die if that technology malfunctions. I mean, that's one of the worst experiences I ever had in terms of trying to understand how could those kinds of things happen? How could we let patient safety not be at the top of the list? How could we ignore the fact that nurses are the ones taking care of those patients? So we have come a long way. We have made great strides in the last 4 decades. We've moved from implementing EHRs to looking at all kinds of implementation of technology in our educational settings. We have also made sure that we have mobile technology everywhere. Again, it's not at the level in all of our communities and countries that we would like. I had the opportunity to help lead a study in the 2007-2008 period of time where we looked at implementation of technology in acute care to ease nursing workload, to improve efficiency, improve patient outcomes. And one of the key findings was exactly what we've talked about many times, which is nurses need to be involved in the early conceptualization, design, testing, evaluation, purchasing, and analysis of technology. And that we've been talking about that and continue to talk about it 15 years later. And hopefully we are getting better, although I still talk with vendors all the time at meetings where they're shocked to hear that we think they ought to not only have a nurse in a leadership role in their company, but they ought to be working very specifically with nurses in innovation and in their development. Also, I had the opportunity with a colleague here in the UK to publish an article it said the same thing in 2013, where we talked about technology enabling nursing practice. Sue Hamer and I wrote about enabling the ordinary. Let's take nursing care from its hands-on, not automated level to a new level where we could, again, add to what nurses could contribute as well as improve the efficiency. Now, let me share with you the aspects that are covered in the International Council of Nursing position statement on the digital transformation and nursing practice. And I've got this interspersed in my comments, but just to start out, basically saying, why do we believe it's important that we have to recognize the role of the nurse to shape digital health? Well, there's a number of reasons. And again, these will all seem very well known to you. We need to support equitable and universal access to health services. We want to increase the efficiency and reliability of our health systems, improve patient and worker safety, respond to shortage issues, decrease costs, and improve health outcomes. And when we go back to thinking about achieving universal health coverage, we have to put people at the center, and we have to be able to radically scale up and strengthen care. We do that by achieving digital transformation that affects nurses. And so this is really something we think about, involving nurses again in decision making, making sure that they're involved in design, because this is what we call an adaptive challenge. We have both technical challenges and adaptive challenges in all that we do. A technical challenge, you have some kind of very clear solution. Adaptive challenges can be a Pandora's box because it relates to changing behavior. Well, adoption of technology is not just the technical, it is an adaptive challenge and an adaptive process. The policy also requires that we align digital tech with patient and nurse safety policies and procedures. We started studying the safety or lack thereof of electronic health records and other technology 20 years ago, and we know that there are practices that are unsafe. We also know that there are technologies that are unsafe, and we report them. And we know that again, if the nurse finds that it's not working for them, they put in place a workaround. And so we want to be sure that that is clear as an expectation going forward. Also promoting and supporting nurse informatics specialists, because it is not up to the bedside practicing nurse or community side practicing nurse to have all the answers, which is why your roles are so critically important. And we need to lobby our governments to provide some of that funding for digital transformation in their health systems. Now, the next slide, I'm going to play a brief video. There's a series that ICN did with the BBC called Caring with Courage. It came out about 2 years ago, but it highlights some of the amazing work that nurses are doing, many times in partnership with tech companies, or in partnership with universities or with other settings where they are helping address these global challenges to achieving global health. But I've pulled out a couple that I think really do demonstrate how important it is that nurses are partners in working with technology. And this one comes to us from Japan.
日本は人口減少、これから続きますから、働く人の人口が減る。そうすると2040年には介護の需要に対して働く人のギャップが69万人という推計が厚生労働省から出ている。こういうことが今最大の課題です。8万人のご利用者が全国にいる。この方たちの大量な介護記録のデータが毎日今データ入力されています。そこのデータプラットフォーム、ファウンドリーという仕組みを活用して、この大きなデータを分析して、そしてご入居者の体調の変化だとか、あるいはそれに対してどのような介護をしていったらいいのかということを予測し、そして分析していきます。
ファウンドリー導入前は出勤時にバイタルとか睡眠時間とか食事量とかいろんなところから情報を集めなければいけないっていう状態でした。でも今はファウンドリーがもう一つに情報が全部統括されているので、本当に一つの画面を見れば情報を得ることができるっていうことになっています。 例えば内服薬の変更があった方で、一見特には何も変わってるようには見えなかった方がいたんですけども、ファウンドリーのアラートで睡眠時間が以前より増えたっていうアラートが上がっている方がいて、それを主治医の方に報告して内服薬の変更の見直しにつながったっていうことがありました。
ですから安心してお世話になってます。
ありがとうございます。こちらこそ。いいですね。ありがとうございます。
具体的に申し上げると、認知機能が落ちてくるんではないか、あるいは栄養状態が悪くなるのではないか、あるいは生活動作 ADL といいますが、歩行だとか立ち座りだとか、こういったような機能が落ちる可能性があるんじゃないか。例えばこんなことが予測できたら、早めにそれに対して手が打てるわけです。
情報を集める時間というのが大幅に短縮されたので、その分時間が空いた分、ご入居者様のお部屋に伺ってお話をしたりとか、それこそイベントをいろいろ楽しむ時間とかが増えました。
So a great example of being able to automate data collection that then is reviewed by the nurse along with alerts in order to then have faster action in addressing the needs of those patients. Now, we've heard mention, and it doesn't escape any of us, that the COVID-19 pandemic had significant change in so many aspects of our work, our personal existence, and the long-ranging effects on the nursing workforce. But we also know that COVID-19 accelerated digital healthcare. And you can see all of these areas on the slide and probably relate to almost every one of them. Telehealth or telehealth applications increased almost 800% in the first 3 months of COVID. Similarly, the implementation in education systems was almost overnight. Remote monitoring became the norm, and we see those applications also for how we were tracking vaccinations, how we were doing contact tracing, and all of those, which is incredibly important as we think about how are we going to handle, prevent, and manage the next pandemic. So we continue to learn from those lessons. But there are also AI remote care systems that we know became essential in getting care to people. So I want to share another example that comes from Taipei University Hospital in Taiwan, Republic of China, which also speaks to 24/7 remote monitoring.
这一次面对这次 COVID-19 的疫情，我们发现说，一个科技资讯化的一个把关跟协助是对于我们照护上是很重要的。那研发出的这台就是零接触全方位跟照护系统时，我们在使用上面是非常及时的，因为数据是24小时可以传输到我们的护理站那个电子白板，可以了解到病人现在的状况。我这个病人这个大姐她爸爸才刚过世，所以其实在平常照护的时候，我们就有关心一下她，今天心情还好吗？就是日常生活的关心。她当下都说还好没事，是到有一次半夜的时候，她那个警示在响，很喘，然后跟她直接视讯，然后发现她在哭。所以我们人员那时候就觉得不太对，就赶快着装进去，然后陪伴着那个大姐，问她说：“你怎么了？”这样，她才说她其实对于爸爸病逝这件事情非常的愧疚，非常的自责。然后我们听她讲完她所有想讲的话，去同理她的一个情绪，然后也让她发泄，然后她到后面情绪就比较平稳。然后如果病人没有讲，我们甚至可能都不会知道，除非我们刚好有进去探视。所以我觉得在这个科技的一个帮忙之下，我们其实在照护上可以更及时。
Once again, nurses became digital innovators. And one of the unique aspects that I hope you picked up in this was the essence of nurses being able to take data, but then understand the social changes in this individual. That doesn't just come from a computer. So being able to blend the high-tech care with high touch is a really new benefit that we're experiencing. Now, we know that innovation is really key to us being able to continue to make those changes to be able to achieve universal health coverage, as well as be able to improve and perfect care to all the people that we serve, regardless of the setting. We also, I want to just focus on that quote at the bottom, which is one of the comments was, coming out of the pandemic, if you bring nurses to the table and you bring informatics, we can pretty much solve anything and do it rapidly. And again, I think that is one of the things we saw in the pandemic. But one of the things that plagued us is that nurse leaders were not always brought to the table to be able to create those innovations, to be able to work with their staff, to be able to interact with the informatics experts. So we need to make sure that if we're ever in that situation again, that nurse leaders at every level are making sure that their voice is heard. As we said before, though, digital health equity, or actually we didn't say digital, we said health equity. Health equity also requires digital health equity. And I'm going to talk a little bit more about the digital divide. When we think about, again, our countries where we have great privilege and great amounts of technology and lots of advances, and sometimes, you know, there are economic sacrifices to make that happen. What we need to also understand about our colleagues around the world is about half of the world's population still does not have internet access. Now that's hard for us to believe because we have, you know, we live with the internet in our hand, right? Every day, or every hour, we're checking our phones, we're making sure that we have that connectivity. But the comparison is that about 80% of low-income countries lack access to the internet. In comparison, in North America, 83% of all people have access. Sub-Saharan Africa, it's only 22%. In the UK, during the pandemic, 22% of high-risk patients and 44% of vulnerable populations reporting difficulty accessing care. And there are historically underserved areas in every one of our countries. So we have gross inequity when we think about digital technologies and digital access. And so part of our responsibility is to close that digital divide. We'll talk a little bit about that. But the good news, too, is that we see nurses being able to innovate, whether they have lots of resources or only a few resources. So starting at the bottom left there, Platform 24 is a proprietary platform, but it's used in Scandinavia and Northern Europe as a patient engagement and virtual care platform, again, heavily reliant on nurses. In the HIV world, there are lots of applications that have been nurse developed. It's not just HIV, but a lot of other detection, early detection in areas such as Brazil, China, India, Kenya, Ethiopia, Cameroon, South Africa, and the US. And so nurses have figured out how to develop apps, sometimes with IT partners, to be able to reach people and understand their symptoms, to communicate with them. And we've seen this in stop smoking programs. We've seen this with sexual health in teenagers. Again, all around the world, we're seeing great opportunities. Also on the more technical side, when the global positioning satellite data became available to track things like vector-borne illnesses and changes in atmospheric conditions, we began to be able to do a better job of predicting allergen, movement, and respiratory illness. So nurses are at the forefront of using these innovations. But we also know 90% of nurses around the world are still female. There is a gender digital divide, and it is not just for nurses, it is for all women. And particularly in poorer countries, even though 80% of women have mobile phones, only about 20% have smartphones. The bottom line takeaway to all of these graphs, which you may not be able to see in detail, is that younger urban males have the highest usage and access to devices and technology. So part of our desire is to make sure as nurses and looking at the people that we serve, that we're understanding their literacy level, both regular literacy and digital literacy, their overall age, are they receptive and capable of using technology? Does income level play into it? And again, what internet access do they have? And why is that important? Well, many of you have been working on how to use technology to be able to measure and address social determinants of health, whatever they're called in your part of the world. But now we need to be thinking about digital determinants of health to make sure that we are, in fact, trying to close that digital divide. Because we know that if we have technology and we have able users and enough of the actual hardware, that we support the research and delivery of care to address social determinants of health. We're able to improve our levels of education. We're able to create jobs. We're able to improve and maintain social relationships among the people we serve and help them get better access to healthcare. Now, I mentioned SDG, or Sustainable Development Goal 3, of which 3.8 is achieving universal health coverage. But essentially, we cannot do that without digital health in all of our communities. It's just not possible in today's world. So as we think about the next parts of the ICN policy on digital transformation and nursing practice, we know that we have to address the digital divide. And this includes recognition about the barriers, and they often are in the low-income countries. Again, making sure that we have collaboration that emphasizes health equity, because it doesn't do any good to continue to provide care only to those who can afford it. Remembering universal health coverage cites that pushing people into poverty is one of the global goals to stop that from happening. We also need to make sure that digital technology is a bridge and not a barrier to healthcare access. Again, it's the haves and the have-nots. So if we're only delivering interventions digitally and we have a lot of people that don't have that technology, then that's not going to be very effective. So it really does become a full cycle of looking at digital capabilities. Now, many of you may be familiar with the United Nations Global Strategy on Digital Health, which is currently driving what is the implementation of digital technology in order to achieve the Sustainable Development Goals. Again, there's nothing we can do in our lives, in our communities, that doesn't in some way touch technology. And again, we see that more and more often in healthcare, but knowing that it's in our environmental work, it's in the food industry, it's in pandemic prevention, it's looking at education, it's looking at job skills. So technology is really key for us to be able to advance knowledge. Now, the global strategy on digital health, however, is really focused on improving health everywhere for everyone, and very consistent with our goals of universal health coverage, but really through the adoption of technology, making it accessible, making it affordable, making sure that we can bring it to scale. A lot of our countries have failed to be able to do this, whether it's because of the economics or just not having the political will. And again, there are those areas where there is discrimination against women in terms of having access to these technologies. One of the other groups very invested in making sure that we are addressing health for the future and are using technology to make those advances is the World Bank. Now, the World Bank often brings groups together. They don't necessarily directly fund projects, but they also bring philanthropists together with communities, with organizations, non-governmental entities, and their goal is to make sure that digital technology is always used for good and that it is used to help overcome health sector challenges and achieve universal health coverage. So that's what you're seeing in this report, Digital in Health, and making sure that, again, it is available for all. And I think this goes along with the discussions that many of you have about democratizing data in healthcare. It's no good to have it held by only a few, or it's no good that it never gets looked at or have access to analytics. I mean, how many of you are researchers or academics or clinicians that have had to fight for access to be able to see the data in your organizations? How many of you have had to have that fight? A lot of you probably. And how many of you are still having that fight, right? Yeah, it's like, oh, you can't do that. You're a nurse, right? It's like, no, I'm a scientist, I'm a clinician, I'm a faculty member. I need to be able to help in the transformation of healthcare, and I need the data. So hopefully we are seeing that ease up as well. Another document that is hopefully going to be a little bit more groundbreaking is the Global Digital Compact. Now, this is, again, a document that says we have to use technology for good. We have to have all the right actions. And this is coming forward from the United Nations, and it will be on the agenda for a special part of the United Nations General Assembly meeting this September in New York City. And that special meeting is called the Summit of the Future. It's actually a very highly politicized charged meeting. But one of the good things that will get discussed and hopefully agreed upon is the Global Digital Compact. And essentially, it calls for closing the digital divide. It also calls for protecting human rights and data privacy, which I'm sure you deal with as well very often, and aligning artificial intelligence, again, to be used for good causes. So this is something that is coming this fall. It usually takes a number of years for the United Nations members to ever get anything out the door. And then, of course, it takes another 5 or 10 years to implement it. But we really hope that this Global Digital Compact, again, will sort of bring together the commitments of countries all around the world so that we can agree on the kinds of data sharing, the kinds of infrastructure that are needed, the use cases, and being able to recognize that we are all very dependent on one another, which is true with everything we try to accomplish in global health. When one part of the system is weak, everyone suffers, just as we saw in the pandemic. And another one? Oh my goodness. Are we all right? Okay. And this. Okay, well, I'm assuming with all these nurses, we'll make sure she's okay. But you know, the statements are, we're not, if one group is not safe, none of us are safe. And it is the same when we think about access to where we're headed in terms of global health digital strategy. Now, something you may be familiar with or may not is a philosophy called stay left, shift left. And this is something that you may have heard talked about in terms of, we need to get care out of the hospitals. We need to get into the community. In the United States, probably 25 years ago, we said, oh, we're 65% hospital, 35% community. We need to flip that. Well, we're still saying that today, right? And there's lots of reasons that countries fail in making those changes. But we're seeing more and more, if we want to prevent illness, if we want to better manage non-communicable and chronic conditions, we have to have a path that gets us from high-tech illness-curing care to be able to put more care in the community. And this stay left, shift left is saying we need to move care from hospitals to community to home. And the recommendation is that if you're a low-income country and you're still in a paper mode, you're still in a very digital poor environment, you need to leapfrog to current technology. And I would just share one example with you, which is in Rwanda. They are using drones to deliver blood products to rural communities. I mean, in some places, you'd say, oh my gosh, how could you do that? It's blood. You know, it needs 1 million people to check it off and make sure it's the right thing. But you know what? Sometimes we have to do that leapfrogging to the future. But we also know, again, nurses are helping close this digital divide. And one of the things I should have said when I was talking about pioneers and stars, I could probably name check half of the things I'm mentioning to you today with your pioneers and stars, many of whom are in the audience, but I'm afraid I would leave somebody out if I didn't recognize the great nurse informaticists and data scientists that are helping do this work. And again, hopefully you've recognized some of that. But again, just sort of going around from the top left, this is an intervention of more rapid HIV tests for infants in Kenya so that they can better diagnose HIV and get care started. Many of you are maybe involved with the Big Data Initiative at the University of Minnesota, again, one where we have our stars here, in terms of really bringing together researchers, academicians, nurses from practice, informatics, and health system leaders to be able to create the next generation of knowledge of using data and making sure that we are improving care. Also, collaborations, things like Uganda and the USA working to make sure that they can improve CPR outcomes, and then Pakistan improving their database in terms of vaccinations to know where they need to focus. This next and last video in my presentation is an example of one of the biggest issues plaguing the world, particularly in rural communities, but you will see it in your country as well. Non-communicable diseases creates many preventable deaths.
One in 5 people suffers from an NCD in India. Like most other countries in the world, India is going through an epidemiological transition from communicable diseases like typhoid, cholera, malaria to non-communicable diseases like hypertension, diabetes, cardiovascular disease, and cancers. NCDs are silent. What that means is that most people, when they have an NCD, don't find any symptoms until it's at a fairly advanced stage.
ನಮಗೆ ಅದೇ ಜಾಸ್ತಿ ಯೋಚನೆ ಮಾಡ್ತಾಯಿದ್ದು ಹಿಂಗೆ ಹೆಂಗಾಯ್ತಲ್ಲಪ್ಪ ಏನು ಮಾಡೋದು ಅಂತನ ಅವಾಗ ಪಕ್ಕದವರೆಲ್ಲನ ಹಿಂಗೆ ತೋರಿಸು ಸಿಸ್ಟರ್ ಹತ್ರ ಅಂದರು ಸಿಸ್ಟರ್ ಹತ್ರ ತೋರಿಸ್ತೋ
ಸಿದ್ಧಗಂಗಮ್ಮ ಅವರೇ ತಿಂಡಿ ಮಾಡಿದ್ರಾ?
ಆಯಿತು ತಿಂಡಿ.
ಹುಷಾರಾಗಿದ್ದೀರಾ? ಏನಾಯಿತು?
ಒಂದು ವಾರದಿಂದ ಹುಷಾರಿಲ್ಲ, ಕಾಲು ನೋವು, ಕಣ್ಣುರಿ, ವಿಪರೀತ ಕಾಲು ನೋವು.
ಇನ್ನು ಏನೇನಾಗುತ್ತೆ?
ತಲೆ ನೋವು. ಅದೇ ಹೋಗಿ ನಾವೇ ಸಿಸ್ಟರ್ದ ಹತ್ರ ಹೇಳ್ದೋ ಹಿಂಗಾಗೈತೆ, ಹಿಂಗೆ ನಮ್ಗೆ ಸುಸ್ತು ಕಾಯಿಲೆ, ಏನು ಊಟ ಮಾಡೋಕ್ಕಾಗಲ್ಲ ಅಂತ. ಅವರು ಕರ್ಕೊಂಡೋಗಿ ತೋರಿಸಿರು, ಡಾಕ್ಟ್ರಿಗೆ ತೋರಿಸಿರು. ಡಾಕ್ಟ್ರು ಶುಗರು BP ಎಲ್ಲ ಚೆಕ್ ಮಾಡಿ BP ಐತೆ, ನೀವು ಮಾತ್ರೆ ತಗೊಳ್ಬೇಕು ಅಂತ ಹೇಳಿರು. ಆಮೇಲೆ ಮಾತ್ರೆ ಎಷ್ಟು ಟೈಮು ತಗೊಳ್ಳಿ ಮಾತ್ರೆನ ಅಂತ ಹೇಳ್ತಾರೆ. ಊಟ ನಿಮಗೆ ಏನೇನು ಇದು ಬೇಕೋ ಅದೆಲ್ಲ ಬದಲಾಯಿಸ್ಕೊಟ್ರಿ ಊಟದ್ದು ಅಂತ ಹೇಳ್ತಾರೆ.
The National NCD program is working at the grassroots to screen all 30+ population of the country. So the whole idea is that we can detect cancer or hypertension or diabetes as early as possible, so that treatment is much easier.
In the app, there are reminders that are built in that will alert the health worker on which patient needs a follow-up on which day for which disease. And this is very important because otherwise people might miss their follow-ups. Today, the CPHC NCD system has achieved a national footprint. There are more than 135 million people who've been enrolled in the system. The system has been deployed in 32 states across 591 districts, and more than 94,000 health workers and doctors have been trained and are using the system.
Siddhamma and millions like her probably do not even know that they suffer from chronic diseases like diabetes and hypertension. The CPHC NCD application helps us track every single patient as to their disease status and plan for their individual treatment, not in hundreds or thousands, but for millions of such people.
ಏನು ಹೇಳಕ್ಕೆ ಬಯಸ್ತೀರಾ ಅಂದರೆ ಹೆದರ್ಕೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಏನಿಲ್ಲ. ಈಗ ಮೊದಲು ಅಂದರೆ ಹಳ್ಳಿಗಳ ಕಡೆ ಇದೆಲ್ಲ ಇರಲಿಲ್ಲ. ಈಗೇನು ಅನುಕೂಲ ಐತೆ ಹಳ್ಳಿಗಳ ಕಡೆ. ಹಳ್ಳಿ ಮೇಲೆ ಸಿಸ್ಟರ್ಗಳು ಬರ್ತಾರೆ. ಇವಾಗ ನಾನು ಮೆಡಿಸಿನ್ ತಗೊತಾ ಇದ್ದೀನಿ, ನಾನು ಎಲ್ಲ ಕೆಲಸನೂ ಮಾಡ್ತೀನಿ, ಸುಸ್ತೆಲ್ಲ ಕಮ್ಮಿ ಆಗೈತೆ, ಏನಂತ ಇದು ಕಾಣಲ್ಲ, ತಲೆ ಸುತ್ತಿಲ್ಲ, ಊಟನೂ ಮಾಡ್ತೀನಿ, ನನ್ನ ಆರೋಗ್ಯ ಚೆನ್ನಾಗೈತೆ. ನಾವು ಸಿಸ್ಟ್ರಿಗೆ ನಾನು ಅಭಾರಿಯಾಗಿದ್ದೀನಿ. ಆದರೆ ಅವರು ನಮ್ಮನ್ನ ಇದು ಚೆನ್ನಾಗಿ ಇದು ಮಾಡ್ತಾರೆ. ಅವ್ರು ಇಲ್ಲದೇ ಇದ್ದರೆ ನಾವೇನು ಆಗ್ತಿತ್ತೋ ಗೊತ್ತಿಲ್ಲ.
So a great example. Imagine scaling any intervention to 300 million people. I just wanted to briefly mention the nursing shortage. You know, we know that we're not going to replace nurses with technology, but we can expand their impact. So the goal is to really look at how can nurses redesign workflow and deploy technologies to help. Now, we've had surveys that nurses absolutely want to get more of their time back. They want to stop the non-value added activities that technology can provide, such as documentation, hunting and gathering time, medication administration, documentation, nursing handoff records, interdisciplinary communication, patient turning, and deliveries, with robots that have been around for quite a long time. We believe that we could actually return about 20% of the nurses' time when technology enablement is in those settings. We also have to remember that we shouldn't be focused just on the technology, but we need to focus on care delivery. What are the changes that nurses need to be developing or respected for developing in terms of their workflow in order to address workload? So once again, we see nurses contributing to this transformation in global digital health with so many different roles. And again, I'm sure across the audience we have everyone in one of these categories or more. And the goal eventually is to improve health care and health outcomes and strengthen our health systems. And also, because you are leaders, because you have advanced knowledge, you need to be the ones influencing policy leaders and government leaders, not only for the funding that's required, but impressing upon them how important this is for safety and better outcomes. So part of our job is to, once again, come back to making sure nurses are involved and they are supported to be decision makers. They are supported to be making sure that technology is user-friendly, because it was nurse developed from the very beginning. We know that poorly designed technology has so many negative effects. Fortunately, there are more investments being made in nurse innovation. Again, it may be that only certain countries are able to take advantage of this right now, but large global investors such as Johnson & Johnson Company have been sponsoring Nurse Hack for Health. They've been sponsoring Nurse Pitch, as have some other organizations, where very significant prizes are being awarded to nurses and their health systems in order to be able to create things like scheduling systems or like auto charting with natural language processing. So it's happening in little pockets, and we're seeing a growing interest. Nurses want to be able to have their innovation supported. And what they've told us is they want to step up. They are ready to shape the next era of digital health. But we need to change the narrative. Again, it's not that nurses aren't ready. It's not that nurses don't want to be involved in technology, but they need to be enabled. I mean, and again, much of this is focused on the hospital, even though there's great technology and great communication advances that's happening in our communities and rural communities. But we also know that the nurse in an acute care hospital setting is so busy, they don't think they have time to learn and be part of these transitions. And that's where, again, our role as leaders really is important, to let them drive innovation and give them the time. More than 70% of nurses responding to surveys want to be involved in innovation. Coming back to our policy, again, it's educating and enabling nurses, and this means going back to the classroom as well as professional development. We know that the current workforce doesn't have all the skills they need, and we know that we're also in the UK, you're awaiting the Phillips and Ives review that has been commissioned for the National Health Service that's going to give recommendations around the skills for safe and effective digital enabled practice. And hopefully that will be out soon. But we also know that in our classrooms, the next generation of nurses, they're learning with virtual simulation in many countries. They are learning with digital tools. They are recognizing that digital health is integral to what they're doing for hospital care, communication with team members, communications with patients. And so we need to be sure that the current and future generations have the competencies to deliver care in a digital environment. We need to begin to have nurses think about becoming data scientists. It shouldn't be reserved for those that have spent 30 years in nursing and have finally, made that transition. We need to have newer generations of nurses being supported in that skill development. We also know, and again, I believe many in this room are the pioneers and adopters of international nursing terminology classification systems. We feel strongly at ICN that the International Classification for Nursing Practice, the ICNP, is one of the best ways that we can begin to have that generalized terminology for clinical practice and be able to have that standardized approach. We know that unfortunately it's not been adopted in all countries. It is now part of SNOMED CT though, and maybe we will continue to evolve professionally and someday be able to bring all of the different terminologies together so that we do have that capture of data, that we do have that database for research where we can have that normalization across the world. So what's next? I haven't used the words artificial intelligence very much at all. And it's not just the next shiny object, but I know that there are discussions everywhere, every day, and I'm sure you will have some great expert conversations here about how do we deal with not really artificial intelligence in its basic sense, because we've been using artificial intelligence and machine learning for decades, but it is the generative AI that I think gives people pause And I think part of it, we're seeing backlash in the U.S. I'm not sure if it's happening in a lot of other places of, oh, we got to be really careful. This stuff could be really unsafe. We don't want all these things out there in the cloud telling us how to practice. Well, that's where I think we need to debunk the myths. We need to make sure that nurses are, in fact, setting the standards, looking at where's the human interface, how do we get the bias out of the databases that have been predicated on, historic trends of looking at what white men and particularly non-people of color in just about every country or lower socioeconomic groups. How do we clean that up so that our generative AI is reflective of how we need to understand the populations that we serve? So nurses have a very, very important role in terms of addressing the developments of artificial intelligence and being able to mitigate the risks, and again, educate our peers that this is not it might be a scary thing, but it shouldn't be a scary thing because it will be ubiquitous in everything that we do, and we see that right now in every walk of life. You can't even turn on your laptop or your phone without getting the little AI thing telling you it's helping you, and it's like, stop, just stop. I don't need 25 answers to a question I didn't ask. So we need to figure out how to harness and control that in healthcare. So let me just sum up all the things that we've talked about and that our policy really does address. First of all, we need to advocate for digital health and closing the digital health divide across all the populations that we serve. And if there are applications that we can put in place to ease some of the workforce shortages, again, take away the work that we shouldn't have to place on the nurse that is burdensome and doesn't add value. We know there are safety issues, and part of our role is to mitigate those so the technology is safe and effective. We also need to make sure we have enough education at every level, existing workforce, up and coming workforce, the people that we serve, to make sure that everyone has the digital skills that are necessary in order to be able to practice in this digital world. Continue to be part of national and global decision making. Again, you are the experts. You have a new and enhanced role, not only to have established who you are and what you do in your organizations, but now to look outward globally as to how you can be part of the influencing generation of nurse informaticists. Making sure that we never lose track of universal health coverage and the Sustainable Development Goals. I personally believe, and I think many of my colleagues in global health agree, that when you look at all the sustainable development, again, it's everything from our food supply and water and land and environmental climate change issues and a good economy and safe housing and things like that. When you put it all together, health becomes so central to every aspect of human life and sustainability. Even the economic issues, again, rely on having healthy people to work, healthy children to learn, healthy societies to be peacekeepers. So everything circles around health. And so it's important for us to be sure that nurses are part of this brain trust in terms of not only shrinking the digital divide, but making sure that we are there, again, advocating through our global practice, through the innovation, because it is nurses that are going to bring home the three key themes here. Equality, and that's equality across all healthcare and equality across digital transformation. Quality, we've always looked to technology to help us improve quality, and then innovation. We have to be able to continue to innovate for the future. So I believe all of you are the true brain trust to come together with a shared vision to be digital health champions. You probably already are, or maybe some of you are still in a developing stage. But we have to be digital champions for equitable healthcare. And I'll leave you with my final slide, which is something you might see. Those of you in the UK certainly know the Banksy photos. So the one on the right is a picture that was done during the pandemic. And it shows the nurse being replaced as the ultimate superhero. And you see Batman and Spider-Man or somebody else in there discarded. And so this was a way to honor nurses as the heroes that they were in many situations during the pandemic. On the left, you see a photograph that is reminiscent of World War II photos that really highlighted the heroes. And it says, there are no extraordinary people, only ordinary people who do extraordinary things, which I believe truly does represent what a nurse is, what a nurse does on every day. And so you are our digital heroes. And I look forward to watching as my career wanes, again, 48 years, that's a long time, but as I look at all of the great work that you will continue to do to advance our health systems globally and to help us achieve universal health coverage, because you are the ones who are creating a more compassionate digital health system. Thank you very much.
Okay. Wow. I just want to say thank you again to Pam for such a wonderful keynote speech. I hope that has inspired you all to go off and learn from everybody else at this conference. We have some amazing presentations, some amazing keynote speakers, and both Leanne and I are really excited with what's to come. For those of you who are lucky enough to bag a ticket, there is a welcome reception now being held in Manchester Museum, which is directly over the road from this building. And there is some refreshments for you there. So if you want to make your way over there, please do. And I'm sure all of the people who you've heard talk this afternoon, so Nicola, Pam, Alan, more than happy to have a chat with you, and we'll see you over there. Thank you.